Hello, I'm Dr. Abhishek Katha, Consultant General and Laparoscopic Surgeon, working at Lux Hospitals, Gachibowli. One of the most common symptoms of abdominal pain is because of acute appendicitis, and hence we get a lot of patients with acute appendicitis. Today, I will tell you what an acute appendicitis is and how to manage it. So, acute appendicitis is nothing but it is an inflammation of the appendix being a part of the large intestine in our body. Acute appendicitis presents as pain in the right lower abdomen, which is sharp and continuous, and it does not go away without a medical or a surgical treatment. Usually, the patients of acute appendicitis are in the age groups of 10 to 30 years. But when the patients are less than 10 years and more than 30 years, then the severity of appendicitis is quite more, and hence we recommend an early diagnosis and treatment for these individuals. Acute appendicitis also presents in the form of nausea, vomitings, pain abdomen, and sometimes fever if it is continuous and long-standing. So early diagnosis is important because this acute appendicitis goes through various stages. The first stage being the inflammation, in which the pain is quite minimal, but then it goes into a stage of abscess formation, which is nothing but pus forming in the appendix. And then it goes into a stage of gangrene, wherein the tissue gets necrosed or it gets dead. And then the last stage is where it gets perforated, wherein it leads to a very severe abdominal condition and it's a life-threatening problem. So early diagnosis and treatment is very crucial in acute appendicitis because surgery is the mainstay of treatment of this disease. And then, so in Lux Hospitals, we always treat the patients with a very minimally invasive surgery, which is laparoscopic surgery. We have open surgeries also, but then it is limited to those individuals who are not fit for a laparoscopic surgery. And the advantages of laparoscopic surgery are that there is a very quick recovery, less pain, and then the patient gets back to his regular activities very immediately. So, to avoid the complications, an early diagnosis and treatment, either in the form of medical or surgical intervention, is a must for acute appendicitis. Once the patient neglects it, the next episode, which comes as an acute appendicitis, comes in a more severe form, and when the treatment becomes quite difficult for us also. So, I hence urge people to come as early as possible when you have a acute appendicitis or any symptoms pertaining to it. Thank you.